Excuse me. Good afternoon. We are now playing with the PB980, and we are going to utilize NIV mode in this video. So this is a great device to use, especially for extubation to non-invasive. We already have the ventilator in the room. Patient's already on it. It's connected. Circuits already together. The only thing we have to change is the patient interface, and we'll start with that. So we have our patient interface that we use for non-invasive ventilation. We do need to change the elbow. We need to remove the elbow with a exhalation with a safety port and add the blue filter without any port. So that way we could have a good proper seal on the mask and circuit. The other difference obviously compared to the V60 is we have a dual limb circuit. Now, when we utilize non-invasive, it's probably best practice to try and match them to their settings or what they were getting on spontaneous or pressure support while on doing their SPT before extubation. So we're going to first initialize non-invasive mode on our machine. We have non-invasive. We have plenty of more options compared to the V60. AC with PC or VC, SIMV, and we're going to go to spontaneous. Let's set up a PEEP of 5. One thing to note, compared to machines that are strictly built for non-invasive ventilation, our pressure support is PEEP compensated. So what that means is, unlike the V60, when you're like 10 over 5, it's measured 5 above 0 and 10 above 0. That gives you the numbers, your IPAP and EPAP, 10 over 5. On this ventilator in non-invasive mode, we are going to get our IPAP by increasing our pressure support. Currently, we have a PEEP of 5, so our settings are essentially 5 over 5. If we want to get to 10 over 5, we would add a 5 pressure support. That means we are 5 centimeters of water above PEEP, which is set to 5. Hence, 10 over 5. And you will see this in your pressure settings or in your pressure readings. Next, we're going to verify our apnea alarms. They should be the same as they were when they were a non-invasive or invasive if you swapped them over, but it's always a good practice to set double check your alarm settings. This is a great thing too, because we don't need to add a backup rate because we have these apnea alarms. Unlike the V60, we don't, where having a backup rate is completely necessary. So we set our apnea alarm, and then we're going to go check our alarms. And then we're going to go to more settings, more settings, and make sure our leak sync is enabled. We also want to increase our disconnect sensitivity. Standard settings, default settings are 40 liters a minute. Now we want to increase that all the way up to 65 liters a minute. V60 is able to do 60 liters. With the Puritan Bennett, we can go all the way up to 65. And this is to compensate for the leak that we will most likely have around our mask, because as we know, it can be difficult to get a perfect seal. Even a seal of 10 or 20, which is really good, it still can cause the alarms. So we have our leak sync on and our disconnect sync. Next, we also want to change our sensitivity. Because we're on a ventilator, sensitivity is usually really low, but on a non-invasive mode with positional changes, coughing, or just synchrony, we want to change this sensitivity of our triggering. So we're going to put it between 8 and 10. Now this is patient dependent, so if 8 or 9 is not working, keep going up. And unlike the Draeger, it is opposite. So the higher the number, the less sensitive, whereas the Draeger is the higher the number, the more sensitive. see what else we have. I was asked about putting it in the CPAP mode. Because this does not have a specific CPAP mode, I did mention earlier that if we drop the pressure support to 0, we are in CPAP mode. So whatever our PEEP is our CPAP. In this case, 5 centimeters of water. I was also asked how I could adjust the trends. So when we want to trend our, so I was asked how to change the trending parameters. When you go to trending, we'll get this screen here on our trends. Now it depends on how long the ventilator's been running. It'll show a string of information here. Now if we want to zoom in on a particular area, we're going to click on the time bar at the very bottom of the graph. You'll see some numbers. You click on it. Then you can scroll, widen the shot so you have a longer interval, or scroll in and have a shorter interval. Click again, and then we're able to be more precise on our graph here. We don't have a lot of data. The ventilator hasn't been on very long, so this is as close as we can get, or as tight as we could get onto this graph. Last question I received was about performing a NIF. If there is a way to do it for the best results. Now on the Puritan Bennett, we go to our respiratory maneuvers and hit on NIF. Whenever we want to start to perform the procedure, all we do is hit push and keep press, and it will perform. Once the patient performs the maneuver, we can hold this up to 20 seconds, and then it'll disengage on its own. Or you release it and it'll disengage when you release it. So here we have our values, a negative NIF point, negative 2.9. Not very great, but if we liked it, we could accept, and then we could try it again, and we have a value to give to the physician. When it comes to the ventilator, I think it's not so much as a coaching thing. The patient will feel that they're not getting the breath, but definitely let them know that they will be stopping, the air will stop, and that's when they want to take a really deep breath, compared to when it is a non-ventilated patient. Coaching is far more important because you need to work on the seal and the timing. So to reiterate, when you're performing a NIF, instruct your patients as to what you're going to be doing to them, and give them a countdown maybe, and say, I'm going to stop the air in 3, 2, 1, and then I'm going to push and hold the start button. Tell them to take a deep breath and release when they have finished their maneuver.